Island Health provides comprehensive healthcare services to over 760,000 residents of Vancouver Island and the Central Coast. For those who live in rural and remote communities, this usually requires a trip to a hospital or health facility in a larger urban center for particular types of care. A hospital stay should be a positive experience that contributes to your improved health. If you're coming in from a rural or remote community, navigating your way through the new environments and systems can be a challenge. This video will prepare you for a successful admission, stay, and discharge at Island Health facilities. It will help you to understand the value of communicating clearly with healthcare staff about your needs and expectations so you can receive the best possible care. Work with staff who are there to help and support you, and actively participate in your recovery from illness or injury on your journey back to health and wellness. Whether you arrive at hospital by ambulance or other means, it is important for the admitting staff to receive as much accurate and complete information about you as possible when you arrive. Having this information will provide you with the best quality of care they can offer. Sometimes emergencies or unplanned trips happen. It is not always possible to have everything as ready as you would like. If you are too ill to gather everything you need ahead of time, ask a relative or a friend to bring them if possible. If you can, you should make sure you have clothing, shoes, your wallet or purse, and keys for your front door, your BC Care card, your status card if you are Aboriginal, any additional health coverage cards such as Blue Cross, your current address and phone number, as well as contact information for your next of kin or a family caregiver, names and contact information for your doctor and other health professionals you are seeing, a list of all your current prescribed and over-the-counter medications, a list of any food or medication allergies you may have, a cell phone if you have one. There are some first steps you can take to ensure your experience is a positive one. Give staff at the facility you're being admitted to permission to share information with other healthcare providers where you live about your healthcare needs and history. If you are Aboriginal, ask to be contacted by an Aboriginal liaison nurse from the facility you are going into. They are there to help you. They have connections with many programs, resources, and networks that can provide support.
The role is one of advocacy and support for Aboriginal people within the acute care setting. There's many aspects to the job, and one of them is discharge or supporting discharge planning of our people coming into the acute care facility and returning back to their home communities.
If things worked out perfectly, it would kind of be like me knowing when they were going down, and if there were any concerns with that particular client, or if that client had any concerns, then they would let me know about that, and I would call down there and I would let the Aboriginal liaison nurse down there know, or social worker know, that I have this client going down and these are the concerns, and hopefully that would she would intervene and provide some support and communicate with the staff nurses down there.
In some communities, Aboriginal health providers offer a range of programs that complement Island Health services. Staff from these agencies often play an active role in ensuring that you receive effective care.
I'm from Ahousaht in Tlaokiat, which is on the west coast, and I've been a registered nurse for about 20 years. This was the day before First Nation advocates, and we're a large family. My mom had 16 children, and so we all wanted to be there with her when she was passing, and we were told that we couldn't all be in that room and that we were going to be limited to 2. That's when the First Nation advocate position came in, and it was the first in all of BC for this hospital here. And I can say, with the First Nation advocate, there's been a major changes, more communication between nurse and staff, the doctors, and a better understanding of the First Nations person.
When you are admitted to an Island Health facility, it will help if you're prepared a bit ahead of time. If possible, write down the questions you want to ask before seeing the doctor. You can ask them to explain the need for tests or medication they are prescribing. If you're having difficulty understanding your doctor, Ask him or her to speak more slowly, or explain it to you again, or ask a friend or family member to be present so they can help out. Your doctor can write things down, draw a picture for you, or explain unfamiliar words in plain language. Don't be embarrassed if you need extra time, or if you don't have the resources to get home on your own. If you tell staff members what your situation is, they will help you find a way to get there safely with the supports you need. If you are not comfortable with how quickly you are being discharged or don't feel prepared, don't worry. You can ask for more time. Island Health has a program called My Ticket Home. It is a way for you to work with the staff where you are admitted to begin to plan for your discharge. Ask if you can see the My Ticket Home form when you are admitted, so you and the staff can begin to fill it out and plan for the day when you will return home.
We've heard that patients like My Ticket Home. They find the written instructions in one piece of paper very helpful and easy to refer to once they get home. Having instructions given to them verbally by many different members of the care team is often easy to forget once they get home. They like the piece of paper to refer to once they're back in their home environment.
When the time comes for you to be discharged from the Island Health facility, the nurse or social worker can help you identify the caregivers, networks, and services that are available to you in your community from staff in local healthcare organizations. If you have a concern, they can help you talk to the right people and follow up on issues where you feel your care could have been managed to better meet your needs. By contacting them ahead of time, they can make your transition back home a more safe and comfortable experience.
The biggest challenge is that every community has different services. The caregivers that we're talking to might be a family caregiver, and they might not be aware of what services are available in that particular community. Some of the islands don't necessarily have a GP practicing, and some remote communities don't necessarily have a general practitioner. So it's hard to get a read on what level of support we can put in place for people.
One of the benefits that I see in rural communities is that people have more informal supports. For example, everyone in a small community probably knows the person. So if you have a disability, then the nice thing about rural communities is you have more of a community support around that person. And because there might be less formal professional supports, it's really nice how the community members step in and maybe take care of that person in that community more so than would happen in an urban center. So I know when we're planning for discharge, that factors in a lot. We know that if the person's vulnerable, then they might be taken care of better in their community just because everybody might know that person and offer a helping hand when they can.
Discharge planning has evolved over the last few years in that we've created more communication, and that has been the biggest drawback in the past is communication and the fact that the client has gone for surgery or testing and we're not aware of it. So the one thing we've done on our end is encouraged all our clients or patients that do travel to make sure our Aboriginal liaison nurse knows, or somebody in the health center knows that they're going to be traveling and they'll be coming back and they may need some services. So that has been our role, and I think the Aboriginal liaison nurse has made great headway there.
In terms of people getting services in town, primary care, being discharged from the hospital, one of the things that we like to ensure is there's proper coordination, discharge planning, so that, say, the hospital nurse liaisons talking with our nurses here on reserve, and that we know what their needs are and we can check up with them and develop care plans. So I think that's something that's been working out fairly well. And with mental health, that's another area where we think there could be partnerships and protocols with the hospital, with the police, and also with organizations like the Crisis Line.
Discharge planning sometimes can be at 4 o'clock Friday afternoon, and a person might go home without his prescription, without his dressing supplies. So my nurse might go into their home on Monday. He needs a dressing change or she needs a dressing change if there's no supplies.
Some facilities have discharge planning teams that will work with you to ensure that your needs are taken care of.
So if they're going to Uqulent, we know that there are some resources out there to support them through mental health and substance use. There are supports regarding home and community care. Those supports are there. Now, if they're going to a house it, which is accessible only by boat and way up, quite isolated, we would have to plan differently, because we know that the resources, if they are there, they're there sporadically.
Locally, discharge planning is carried out very well. We have an interdisciplinary team that gets together to talk about what the needs of the patient are and how to best support them so that when they go home, they won't need to be coming back right away. So the team works together very well. There's a social worker, sometimes the physiotherapist, sometimes home and community care gets involved, whatever the needs of the patient are, to make sure that when they get home, they still have care and that they're going to have what they need when they get home, making sure that they have their meds, making sure that they can make it up the stairs, those kinds of things. So again, small town stuff, we know the person, not just the patient.
As you prepare to be discharged and return home, it is important for you to plan for your continuing health issues and any follow-up appointments. It is fine to ask questions. Make sure you know what arrangements are being made for you. Work with the facility staff and resource people where you live to have a plan in place. Ensure that you have transportation arranged to get home safely. If you have not been able to arrange this or cannot afford it, tell your nurse that you will need more assistance before you can be discharged. If you don't feel confident about traveling alone, try to have a family member or friend go with you. Know when and where your next doctor's appointment is. Understand clearly how and when to take your medication. Do you have enough medication to last for the first few days after discharge? Often there will be waits to get prescriptions filled in smaller community pharmacies. Ask the pharmacist on the unit if you can arrange to have the medication sent to your local pharmacy before you are discharged. You can also ask for a temporary supply to take with you. Make sure you have proper clothing for the trip home. Check the weather ahead of time. Have enough money to deal with small changes of plans as you travel. Make arrangements with family or friends to have a few days of basic food supply available. Depending on where you live and their availability, local care providers or volunteers may be able to visit you when you arrive home to provide support and information. By following these steps and being prepared with complete and accurate information and being ready to ask questions and to participate with your healthcare team, we can all work together to ensure you have a positive experience at Island Health.